So we continue. The next thing we're looking at is common methods of suicide. So most of these, you know them. The first one we have is pesticide injection poisoning, which occurs in 20% of global cases. And so, in many cases, you find that, especially in the rural areas, people resort to using pesticide to commit suicide. The other one is drug overdose. They will take drugs, the prescribed drugs are given at the hospital. Others may be piling, in cases of patients, they'll be piling pills, they're given tablets, they keep them under their pillow. For 2, 3, 4 days, they come up with a high dose and take them at once. The next one is hanging, very common as well. Stabbing, drowning, shooting oneself, jumping from heights, starvation, electrocution, intentional motor vehicle accidents, falling in front of moving vehicles, pouring petrol on self, etc., etc. Those are some of the methods that people use to commit suicide. So we have suicidal clues. The next one is the signs of suicide. These are suicidal clues. The first one we have is verbalization. So when a person is verbalizing, speaking about committing suicide, speaking about dying, wishing for death, do not take that for granted. Do not think it's attention seeking. In most cases, the people that talk about committing suicide, they successfully attempt or successfully commit suicide. So verbalization is very important. Do not take it for granted. The second one is farewell letter writing. Someone will be saying bye to the loved ones, friends, indicating that they are going somewhere, which some of them may not even indicate that I'm dying or I'm leaving. They're just saying bye, but not exactly telling you where they are going. The next one is homicide. Find this person who is married or even not married, they have children, but they have a problem and they want to kill themselves. They'll start by killing children. When you, for no reason, you see someone committing homicide, killing children, just to know that the next step is killing themselves. So treat that as an emergency. Preparation of estate will. When someone is writing a will, when they are okay, they are not sick, they focus on writing their estate will, know that there are thoughts of dying in their heads. The next one is destruction of valuable properties. All of a sudden, someone is destroying property, breaking vehicles, breaking their houses, breaking phones, breaking every valuable property. Know that they may wish to die. And before they die, they will have to destroy everything in order for others not to inherit those things. The next one is social withdrawal. Here is a person who used to be found with friends, families, just withdraws, always alone, always in solitary places, in the bush, sitting under a tree alone, in the home, just locked up in the room, anywhere, they're just alone. The last one we have is possession of harmful substances such as firearms, chemicals, like the pesticides we talked about earlier. Okay. So the next one we have is myths surrounding suicide. People who talk about suicide will not really do it. That is a myth. It's not true. Almost everybody gives a prior warning, such as you will be sorry when I'm dead or when I'm gone. I can't see any way out. Those are words of someone wishing to die. Everyone gives a sign that they are going to do it. That if a patient is determined to kill himself, nothing can stop him. It's true. It's not true that when someone wants to die, you cannot prevent it. You can intervene, you can talk to them, you can counsel them, you can support them, you can take them for care at the hospital. They will recover. So management for suicide, successive suicide has no management because death would have already occurred. So prevention for suicide. Prevention of suicide, we need social support in families, in the communities. We also need to detect high-risk groups in order to offer them support, active treatment of any mental illness, but also to ensure overprescription of medicines is avoided and medication to be kept by relatives. Community centers must be established in order to give support to the community. Helplines, where when you hear or you notice someone is almost committing suicide or is showing signs of suicide, you can call a helpline to bring in counselors to intervene. We also need Samaritans who can just offer help to people with problems. Please take note that suicide risk increases when the patient's condition is improving from severe to moderate depression. Okay. So now we look at the management of a patient with suicidal ideations. Remember, you cannot manage suicide. When suicide is successful and the patient would have died, it is a successful act of killing oneself. So you cannot manage death. Someone has already died, it is done. But someone with suicidal ideas, we have critical areas of concern. The first one is environment, the second one is hygiene, nutrition, medication, self-esteem, and self-image. Okay. So in environment, we have 3 columns. We have critical area or problem identified, rationale, intervention as the last column. So the first row, we have environment. Why should environment be of concern for us? The rationale is in order for a patient not to have any access to any means of suicide. You take away everything that the patient can use to commit suicide. So the interventions that you would employ are nurse a patient in seclusion, seclude the patient, lock them up in a seclusion room, free from harmful objects, free from blankets, sheets, and mosquito nets. Okay. The next row is hygiene. Your concern is to prevent self-drowning. So the intervention that you bring across is supervise baths to avoid drowning, remove all water storage drums, allow the patient to probably use the shower and bathing. The third one is nutrition. Why is nutrition an area of concern for us? The rationale is to improve patient nutrition and avoid starvation, which may lead to death. So the intervention is supervised means to prevent starvation leading to death. The fourth row is medication. The rationale is to improve the health of a patient, treating the cause of those suicidal ideations, be it depression or any other condition, and prevent pill piling, which may be used as an overdose to successfully commit suicide. The intervention is monitor drug intake to prevent pill piling to cause an overdose that may lead to drug poison. The last one is self-image and self-esteem. The rationale is to improve self-worth and build self-image. The intervention is provide psychotherapy to build self-esteem and self-image. For this one, you need to compliment the patient when they do something good. Whenever they succeed in what they are doing, praise them. Inform them that you've done well here. Please keep it up. When they bath, they look good. Ensure that they look good. Choose clothes for them. Praise their looks. Let them look good. By so doing, the sense of worth will begin coming up. The self-esteem start building up, and the self-image will change. So that is how you look at, you care for a patient with suicidal ideas.